Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid mistakes, and above all else, get the most out of your Medicare benefits. Now, today's topic is what you need to know about HSAs and Medicare. And in order to explain HSAs, what I'm going to do is I'm going to answer three particular questions. Question number one is this: what is an HSA? An HSA stands for Health Savings Account. Notice I said Health Savings Account. I didn't say Health Reimbursement Arrangement. That's an HRA. Nor did I say a flexible spending account. All right. And so both of those are plans that you may be on or eligible for, but I'm only talking about HSAs, not health reimbursement arrangements or flexible spending accounts. All right. Now, what is an HSA? An HSA is a tax advantaged medical savings account. Money that you can actually set aside for future medical expenses, and it's tax advantage. Every HSA has to be a qualified plan, which means one of the qualifiers is it has to be tied to a high deductible health plan. It's going to be a higher deductible than most plans are. And the beauty of them is this: all the money that you contribute to your HSA is what we would say is pre-tax, meaning it's not subject to federal income taxes, and many times not subject to state income taxes. So you make these contributions and it's pre-tax money. Okay, so that's an HSA. Now the second question is this: can you contribute to an HSA? What I mean by that is once you go on Medicare, can you contribute to an HSA? And the answer to that is no, you cannot. If you decide to take Medicare A only, or you take Medicare A and B, once you take any form of Medicare, you cannot contribute to an HSA. Now, your HSA money is still yours, but no new contributions can go in. So here's where the problem lies. The question is Part A required? Many of you are not going to stop working at 65. You're not going to take Medicare now. You're not going to take Social Security now. You're going to wait until you hit your full retirement age. And so the question is, if you're still working, do you have to take Medicare A? And the answer to that is no. Okay. Now, many of you will hear that if you keep working, you still have to take Medicare A, and if you do not do that, you're going to be penalized. And folks, that is not true. You're not required to take Part A as long as you or your spouse are covered by an employer-provided plan, a plan that you're going to stay on, you like the plan, the cost, the coverage of the plan, and you're not going to take Medicare yet because you're covered by this employer plan, you or your spouses. Do you have to take Part A? And the answer is no, you do not. Okay, but if you do take Medicare Part A, right, by itself, because you're fearful that you may get penalized, even though you're still working or your spouse is, you must not stop your contributions to your HSA. The other issue becomes this: once you do decide to retire, Medicare is going to backdate your Part A. So let me just give you a quick example. Many of you watching this today, your full retirement age is at 66 and 2 months, meaning you were born in 1955. Some of you, your birthday's in 1956, and your full retirement age is going to be 66 and 4 months. So let's say, in my example, that you're going to continue to work until full retirement age, and you're going to retire at full retirement age, and you're going to start taking your Social Security, and you're going to go on Medicare. So here's what's going to happen. Let's say that you hit full retirement age, let's just call it July 2021, and you're going to retire, and you're going to enroll in Medicare. Now, they're going to give you a B date. Your Medicare B, this part here, is going to be your retirement date. You actually get to select that. But they are going to backdate your A date. And so when they backdate, they always backdate 265 or 6 months, okay? Whatever is sooner. And so in my example, you hit full retirement age at 66 and 2 months or 4 months in July of 2021. They're going to backdate your A date 6 months. So that is going to be 1/1/2021 will be your A date. So we have different A and B dates. So they backdate it 6 months. And here's my point. You do not want to make any contributions from this point forward. So that's why you'll read, once you have set a retirement date, be sure to stop making contributions to your HSA 6 months prior to that, because they're going to backdate your A date. All right. And so this becomes an issue when you have an HSA. And so that brings us to our final question: how can HSA funds be used? So once you're retired and now you're on Medicare A and B, how can you use this money that you've been saving throughout your time during your HSA? Well, first off, your Part B monthly premiums. Right now, Medicare A is free, but B has a premium for most people. That's $144.60 a month. right? Now, if you're on Social Security, that actually comes out of your Social Security check. If not, they're going to bill you for that. But the point is you can be reimbursed for that, or you can actually pay that out of your HSA if indeed you're being direct billed. So your monthly Part B premium, $144.60 this year. Of course, that'll probably go up over time, but that money can be paid out of your HSA. Your Part B deductible this year is $198. So whatever the deductible is for the year, again, your HSA funds can be used to pay that deductible, which is on an annual basis. Now, Part D plans are drug plans, and those premiums are going to range anywhere from about $13 a month upwards to maybe $80 or so every month. And if you're on a drug plan, your HSA can be paying that particular premium. And then, of course, drug plans have deductibles, and they also have copays. And sometimes we hit the donut hole where we have co-insurance. But any kind of prescription drug cost can be paid through your HSA account as well. And then that brings us to Advantage plans. Now, some of you are going to decide to take Advantage plans. They're called replacement plans. Some of those do have monthly premiums. Sometimes there's deductibles on the drug plans. They also have co-pays and co-insurance because Advantage plans are pay-as-you-go. And so if you're on Advantage plan, as you have these co-pays and different expenses, you can use your HSA money for those expenses as well. And then another nice thing about HSAs is miscellaneous medical. What I mean by that is typically dental or vision or maybe hearing aids or hearing exams. Some of those things that Medicare may not cover, you can use your HSA to pay those costs as well. And then you see this word here called excess charges. There are some physicians that take Medicare patients, but they add to the bill. And when they add to the bill, that's called 15% limit on that excess charge. And there are some plans that you're responsible to pay the excess charges. And so you, again, can use your HSA for excess charges. So as you can see, most of your medical expenses can be covered by your HSA funds. There is one item, though, that you cannot pay out of your HSA, and that would be a supplemental plan. And so many of you will buy supplemental plans. Most people today are buying F plans or G or N plans, but the supplemental premiums cannot be paid out of your HSA. Those are also called Medigap policies. So of all the lists, that is the one item that would be excluded from you being able to pay from your HSA funds. And so HSAs are wonderful accounts, and this is how they work once you go on Medicare. To learn more, watch the related video or check out our most recent video. Also, be sure you click to subscribe for free and get notified every time we post a new video. To watch our complete Medicare workshop, go to MedicareSchool.com. And finally, when you're ready to compare all your insurance options and get free enrollment help from one of our Medicare School guides, call the number on the screen. See you next time.